Hi there, I'm Dr. Tammy Balatgek from the Center for TMJ and Sleep Disorders, and I'd like to welcome you to our show, Your Mouth is the Door to Your Health. Today we're joined by Ann, one of our patients who has experienced some ear pain and snoring and other issues and has received treatment in our office. So we're very blessed to have her here to share her story.
Thank you.
Welcome, Ann.
Thanks.
We'd like you to just share what you went through. If you want to start by talking about your initial symptoms, what led you to come into our office, that would be great.
Several months ago, I started with ear pain, which was diagnosed as an earache, and I was treated for that, and it only got worse. And as the ear pain got worse, so did my balance. I really became very dizzy, and with that came more congestion in my ear. I could actually almost feel fluid going back and forth in my ear. So I ended up seeing a ENT specialist because they thought I had some kind of ear infection, and within about 2.5 seconds she diagnosed that I had TMJ. She actually looked at me and she said, "There's nothing wrong with your ear, you have TMJ." And my jaw dropped at that point, and I went, "So what do I do about that?" And she said, "Well, you need to see a TMJ specialist." So I went back to my colleagues at work who gave me Dr. Tammy's name, and I immediately called the office, and right from the start, it was a fabulous experience. I actually gave my symptoms to the girl who answered the phone because all of my friends were saying, "You don't get dizzy from TMJ, Ann." And of course, I'm Googling it and I'm saying, well, that's part of it. And when I shared my story with the receptionist, she said, "Oh, absolutely, you can be seen here." I mean, she just sort of confirmed that I wasn't losing my mind. And so I had an appointment within a week, and the first appointment was, I was immediately felt very welcomed in the office. The girl who took my history she wrote everything down, and it was very obvious from the time that you walked into the exam room that you had already reviewed all that, because I didn't have to repeat it all, and it was a pretty lengthy story. And you examined me, and from there it was confirmed that indeed I did have TMJ, and those symptoms I had were from that, and not that I was losing my mind.
And if I can interrupt for a minute, what was that time span when you first had the earache until you finally talked to the ENT? And what other physicians or diagnosis or treatments did you try in between there?
It was probably around 3 weeks. It was pretty rapid because after I went to an urgent care for the earache, and then about a week and a half later I saw my family physician because of the unsteadiness. And that same day I actually was able to get an appointment with the ENT physician, and then within a week I was in your office. So it was about three weeks or so.
Yeah, that's wonderful. Sometimes patients will go for several years without getting answers and getting to the right place.
Well, I never had the normal clicking that everybody else had. So, everybody always said, "Oh, and I never had that." So we really did think it was ear something.
Sure. And if I can just take a minute to explain what Ann went through. This is a skull which shows the jaw joint, so we call that TMJ, short for temporomandibular joint, and it's located right in front of our ear canal. And that jaw joint is a ball and a socket joint, and the ball part is on the lower jaw. The socket part is actually the ear bone. So if a patient has any kind of clenching or grinding force, or if the bite is out of alignment, that ball is going to rub on the ear part of the socket and can cause ear pain and pressure. And where the dizziness comes into play is there's also a crack in this bone from the jaw joint to the ear canal. So fluid can pass in between the jaw joint, which is naturally occurring, into the ear from that high pressure. And once we get a fluid imbalance in our ear system, then we can feel dizziness. And could you share a little bit about how that affected your activities, like your bike riding?
Well, I'm pretty active. I ride bike on the road, so it was pretty hard to keep my balance on the bike. So luckily I have very good friends who watch out for me at intersections. But when I went back for one of my follow-up appointments, I said I'm really distressed about the biking because that's something that I do. Even walking, even like taking my walks, I would kind of be like this on the road. So Dr. Tammy suggested I use the bottom part of my mouth gear, and I did that for about a month, I think, and then I could feel that maybe I didn't need it anymore. So I would say I'm probably about 95%. I still have some residual balance issues, but it's not. In fact, I actually had a colleague at work tell me that they walked down the hall behind me several months after I started wearing the mouth gear and had seen Dr. Tammy at first, and she said, "Ann, you're walking straighter down the hall." So it was like even my friends noticed I was getting better. So, but the biking was a big deal for me to be able to not feel like I was going to fall off my bike.
Yeah, so we talked about your symptoms of the ear pain and the dizziness, and then she came in for an exam and consultation. And do you want to explain a little bit about the treatment, what you wear at night? I have a sample one here.
It's a very small one. I have a much bigger mouth than that, apparently. But sure, I came in and had all the x-rays done. And again, it's so well managed. And I thank you for that. It was, very efficient, and you just feel very cared for in the office. And that's a great thing. And so then I ended up with one of these little mouth guards, which I wear every night. And it, at first it's it's a little, these things on the side here that you probably can't really see, but they're a little more compliant, I guess, and then or pliant. And then as you start to wear this after a few more weeks, they make it a little bit tighter and stiffer until really you can't open your mouth very far at night, but it did help my snoring, so I'm told.
Yes.
But the mouth guard is very easy to wear. It's not, you kind of look at that and you think, oh, but no, you get used to it, just like anything.
Right, it's custom fitted, so it is made to fit your mouth. And the way it works is if Ann was having pressure in the joint with the balls sticking up against the socket, by putting something in here at the teeth, it moves that away, and then you get relief in the jaw joint. And what she was saying about wearing the lower piece during the day is this appliance is a two-in-one piece, so it can be taken apart and then just wear the lower piece during the day, and that way you can talk and still function, but it keeps that jaw in position. It keeps it down and forward and open. And this is not an exact science. That cartilage, there's a piece of cartilage inside here that's always moving. And so when you say there's still 5% of some healing to be done, it may mean just changing the position a little bit to keep up with that cartilage movement in there. So that's why we see our patients at regular intervals, and usually about once every 6 months or every year after you're stabilized. So do you have any advice for anyone else who might have these same symptoms, or any recommendations that you could give based on your experience?
Don't wait too long. When something like that happens, sometimes I think we sort of like sit back and go, it's going to get better, it's going to get better. But I highly recommend making the call and having it taken care of, because it really did change my life. I had a rough 2 months, I would say, till I was put back together again, and it was very beneficial to be seen and taken care of, so thanks.
Yeah. Well, thank you. Thank you for joining us today and sharing your story. We know there are many other patients out there who might be suffering with ear pain and dizziness and headaches, jaw pain, snoring, sleep apnea, and we would love to help you feel better. So we are located on Route 10. The address is Reading, but we're out near the Penske building across from Dan's at the Green Hills Inn. And our phone number is 610-796-2835, or our website is tmjsleepcenter.com. Thank you and have a great day.